A successful orthodontist, Dr. Albert Repicci has practiced his profession in Greenwich for a number of years. But in 1980, the year of his 40th birthday, he turned down a path that would take him to places he'd never seen, much less heard of.
I knew that this was the year that I was going to have to pull it off, that I'd given myself this deadline, and if I let the opportunity escape, I could blink my eyes, 20 years will go by, and I'll say, I never did it.
Call it charity or missionary work, Dr. Repicci wanted to help those who had no help. He had the ability to provide basic dental care to those who could neither afford it, much less find it. The question was where to start. The answer was the island country of Antigua.
I didn't know where Antigua was at the time. I just said to him, where is it?
Nestled in the Caribbean, Antigua was a long way from Greenwich.
But when it finally came to actually leaving for the airport that February morning, I remember being so anxious that morning that I was close to nauseous.
But maybe more concerning than the geographical implications was the fact that Dr. Repicci would be alone medically as well as physically.
You're going down and trying to provide health care services, and they're of a surgical nature, and you get beyond your capabilities, or you get into trouble and there's no one there to bail you out. That's a nasty situation to be in.
Yet it was a situation that Dr. Repicci was willing to put himself in. When he arrived, he found a small room in the back of a church with an old dentist chair and a long waiting list.
Iola Lewis, want to come back in, please?
Used to dealing with braces and retainers, it was now back to the basics, pulling teeth.
And that's what happens sometimes.
The idea of seeing 30, 40, 50 patients really doesn't portray the realities of what you're up against. You can spend all day and take out 6 tough ones, or if things are moving along pretty smoothly, you can do 50, 60.
Upper right cuspid and first bicuspid.
As I came to realize, you've got somebody who walks up to you in acute pain, and 15 minutes later they walk away from you and they no longer have any pain, and when the anesthesia wears off, their problem has been resolved. You know you've helped that guy.
Dr. Repicci returned to Antigua for 10 years, but instead of just treating the problems, he wanted to come up with a way to prevent them altogether.
If you tried to assess the value of the service you've rendered merely based on the work you've provided while you were there, invariably it's limited. So you always try to bring some aspect of the project home. What can you do from home? What can you do to sustain the health care delivery after you've left?
The answer was simple: fluoride.
There's enough fluoride here for 3,000 kids for a 3-year. So the dosages, 30 dosages per year.
It's something we Americans take for granted. However, in Antigua, there was no fluoride, at least not yet. Dr. Repicci met with Antigua's Minister of Health to discuss his idea.
And we told him, I said, we can do this for every kid in the country. So the following year, we brought down enough fluoride for 10,000 kids, which was the total youth population between age 6 and 12.
Now remember, when you put the solution in your mouth, do not swallow it. And begin. Okay. Put the fluoride in your mouth, just as your teacher is. Up into your mouth, get it all in, and just hold it there. Squish it around between your teeth.
Now remember, children, when you do spit it out, be sure that you're not spitting it on the person next to you, so stand apart from each other a little bit.
Anyway, that was a very rewarding step that we took there.
But it was just the first step on the road of what was to come.